had 366 deaths. The fact that we have such a low prevalence here in Kentucky, I think it's overkill. My name is Dr. Molly Rutherford. I am specialized in addiction medicine and family medicine. So I'm a primary care doctor who also treats addiction. And I'm located in Crestwood, Kentucky, which is about 20 minutes outside of Louisville, Kentucky. I treat addiction. I've had a few people relapse on heroin and opioids because of just being isolated and just the stress of not having a routine. They haven't been able to get in for their therapy appointments. In Louisville, we have seen an increase in the number of shootings and homicides, number of overdoses. There have been some small businesses that have closed. They're not going to be reopening. We've had 366 deaths. And just for comparison, if you look at the causes of death in Kentucky in 2017, I believe we had over 900 deaths from influenza. We have not been very hard hit in terms of the virus here. The hospitals have not been overwhelmed. They built a hospital at the Kentucky Expo Center in Louisville just in case we needed overflow. That was never needed. Just based on the fact that we have such a low prevalence here in Kentucky, and also the fact that this virus really is not much of a danger to children. I just think that it's going to be more harmful for our children to be living in fear with these recommendations than to be sensible and try to keep hands washed and to try to protect vulnerable. The chances of your child catching COVID-19 going to school are fairly low, and if they do, they are likely to do fine. You don't really have to worry. You're probably not going to catch COVID-19 going to Walmart. That's not how it's spread. So as long as people are smart and careful, we really need to redirect our focus to protecting vulnerable people. I hope that our policymakers will take all of that into consideration and revise these models and hopefully inject some common sense in there as well. Those CDC guidelines to me are pretty frightening. And maybe they are needed in very crowded urban areas where the virus has flourished. But in states like Kentucky and rural counties like mine, I think it's overkill.